Today, we're walking a medical tightrope. We're going to talk about something you probably sprinkle on your food every single day: salt. But inside our bodies, sodium is part of this incredibly delicate life or death balancing act. And when doctors get that balance wrong, well, the consequences can be absolutely catastrophic. So I want you to keep this question in your head as we go through this. What if the cure was more dangerous than the disease itself? It's a terrifying thought, right? And it's a dilemma that plays out every day in hospitals, especially when doctors are dealing with something as seemingly simple as sodium. You see, sodium is absolutely essential. I mean, it helps run our nerves, it contracts our muscles, and it keeps our brain firing on all cylinders. But here's the catch. It has to be in a perfect, delicate equilibrium. Too little or too much, and the whole system just starts to break down. So let's start with the first side of the problem: not enough salt. In medicine, we call this hyponatremia, and it means the concentration of sodium in your blood is dangerously low. Think of it this way. Your blood becomes way too watery, and because of this process called osmosis, all that extra water starts flooding into your brain cells, causing them to swell up. Okay, but before we dive into the truly life-threatening stuff, you have to know that sometimes lab results can be, they can be misleading. A doctor can't just see a low sodium number and immediately jump to a conclusion. They have to stop and ask, is this a real emergency, or is something else just making it look like one? And there are two main culprits for one of these, let's call them false alarms. Over on the left, you've got a simple lab error, where things like high levels of fats or proteins can just confuse the machine. But on the right, it's a bit more interesting. If someone's blood sugar is crazy high, that sugar acts like a sponge, pulling water into the bloodstream and just diluting the sodium. In both cases, the real problem isn't a lack of salt, so the fix is to treat the underlying issue. Get those fats or that sugar under control. All right, so now we're at the very heart of the matter. For true severe hyponatremia, the treatment comes down entirely to one critical factor: time. How fast did this happen? And believe me, the answer to that question is the difference between saving a patient and causing a devastating permanent injury. This table just lays out the two scenarios perfectly. On the left, you've got the marathon runner. Their sodium crashed in just a few hours. Their brain hasn't had any time to adapt, so it's swelling up, and it's dangerous. The goal here is simple: correct it fast with a powerful saline solution. But now, look to the right. Here's a patient whose sodium has been low for days, maybe even weeks. Their brain has slowly and very carefully adapted to this new normal. And this right here is the critical distinction. For them, you absolutely must correct it slowly. And this is it. This is the single most important rule when treating someone whose sodium has been low for a long time. Doctors cannot, under any circumstances, raise the sodium level by more than 8 millimoles per liter in a 24-hour period. It is a strict, non-negotiable speed limit, because breaking this rule leads to an absolute medical catastrophe. So what happens if you break the golden rule? What is this terrible consequence we've been building up to? Well, let's meet the villain of our story. It's called osmotic demyelination syndrome, or ODS. And here's the really chilling part. It's a man-made disease. It is caused directly by a doctor correcting chronic low sodium too quickly. It's a direct result of that life-saving cure being given the wrong way. So here's the chain reaction that leads to disaster. First, over days, the brain cells adapt to that low-sodium, watery environment. Then, a doctor comes in and introduces a high concentration of sodium way too fast. In response, water rushes out of those adapted brain cells, causing them to shrink violently. This process literally shreds the myelin, that's the protective insulation around the nerve cells, leading to permanent brain damage. And the results, they're devastating. A few days after the so-called correction, the patient starts developing these awful symptoms: confusion, muscle stiffness in all 4 limbs, and profound difficulty speaking and swallowing. In the most severe cases, it can lead to something called locked-in syndrome, where the patient is fully conscious but completely unable to move or communicate at all. The damage from ODS is actually so specific that it creates a unique pattern on a brain MRI. Doctors look for what's famously called the trident sign. It's a clear, tragic visual confirmation that this preventable injury has occurred. Now, to really appreciate the complexity of that low-sodium problem, let's just briefly hop over to the other side of the tightrope: hypernatremia, or having way too much salt in the blood. Hypernatremia is basically just a state of dehydration. The blood is way too concentrated because there isn't enough water. You see this a lot in patients who can't drink for themselves, like someone with advanced dementia or who's had a stroke. And if it gets severe enough, yep, this can also cause seizures. But just look at the treatment here. It's so much more straightforward. If the patient is awake and the level is only a little high, the treatment is as simple as it gets. Drink water. If they're confused or having a seizure, they get IV fluids to rehydrate them. It just doesn't have that terrifying tightrope of ODS that we see with chronic hyponatremia. So how do doctors stay on that tightrope? How do they give just the right amount of sodium at just the right speed to avoid disaster? Well, they don't guess. They use precision math. The goal is always to get the patient's sodium level back to the normal range, which is right around 140 millimoles per liter. The math is what gives doctors the roadmap to get there safely. So here's how they break it down for, say, a 60-kilogram female whose sodium is at 120. First, the doctor calculates her total body water, which is about 30 liters. Simple enough. Then they find the gap between where she is now, 120, and the target of 140. That's a gap of 20 points. Finally, they just multiply those two numbers to find out she needs a grand total of 600 units of sodium to get back to normal. So you see, the math gives them the total amount of sodium they need. That's the what. But the golden rule, that dictates the rate. That's the how. It just shows you it's not just about what you give, but how fast you give it. And that balance, that is the true art and science of medicine. It really makes you think, doesn't it? I mean, sodium is one of the most basic, fundamental elements in our entire body, and yet managing it correctly requires this incredible level of precision and foresight. It really leaves you wondering what other seemingly simple processes are actually these intricate high-stakes balancing acts happening inside of us right now.